The Honourable Maggie Barry.
Thank you very much, Mr Speaker. July the 1st. It's a great day to take the temperature on the health of New Zealand. A very impressive list of measures have come into being today. All children under 13, free prescriptions, free general practitioner visits. That is going to positively impact on the lives of 750,000 New Zealand children. That is outstanding. It is, I feel, a measure of a successful society, how you treat your most vulnerable at both ends of life's continuum. So I'm very pleased on a personal level to see that today we have a number of measures coming in to really impact well on the end-of-life care for many New Zealanders. This John Key-led government believes in targeted, timely funding of life's fundamentals and the difference it can make not only to the quality of life but also to the quality of life that is passing. And from today, an additional $13 million in funding will be helping hospices and rest homes provide better quality palliative care for those who are in those last stages of life. This is the first year of a $76 million commitment, and over the next 4 years, some $16 million of that funding will be going into the Auckland area, for example. I'm very proud to say into my own North Shore electorate, which is already an outstanding example of its kind with the North Shore Hospice, but it will definitely benefit from that extra additional funding. Not only for the people who want to pass in hospice themselves, but also for those who want to be at home for those important last times and last days. I know very personally how important quality palliative care is. I was the patron of Mary Potter Hospice where my father died, and also I've been patron of Hospice New Zealand for many years. My mother passed away in a rest home, and the variation in the ability of those different places to deliver end-of-life care is something that I think we need to be very mindful of. But the hospice funding will certainly make a difference. When I became a Member of Parliament back in 2011, I was a co-founder of the all-party parliamentary group on palliative care. It's a complex area of medicine, but we wanted to be able to share with palliative care specialists, with our parliamentary colleagues, some of the impacts that it can make on the psychological, spiritual and social well-being of the patients and of their families. In 2013, more than 15,000 people received care and support from hospice services, and hospice staff made over 145,000 home visits. And being able to have that choice to have your last breath at home is something that's very important to many people. An additional 3 million people this year, rising to 7 million next year and then on, will support the recruitment of 60 new nurse specialists who are palliative care educators and also forming other roles at hospices. So these are the nurses that are going to provide a crucial role, helping to train, to mentor and support staff across aged residential care, across GP practices and also home-based support services. I mean, generally speaking, at a time when many countries are cutting back the amount of money that they put into health, freezing it or even cutting it, National will be investing more than $400 million each year in public health services. And that is a tribute to the prudent economic management that is practiced on this side of the House. As the Minister for Seniors, I am very aware of the impact our ageing population will have on this country, and we need to plan ahead for it. We need to be able to support palliative care in rest homes, and we will need more specialist facilities for conditions like dementia in the future. In 2001, there were some 48,000 New Zealanders that suffered from some form or some degree of dementia. In the next 30 years or so, that is forecast to treble to around 150,000 of the population. The member opposite from New Zealand First may well make fun of it, as he indeed is closer to both of those target groups than anyone on this side of the House. However, it is not a laughing matter. We are going to be putting $47 million extra into dementia care since we have been taking office. And it really does sit well, Mr Speaker, with our annual investment in aged residential care. It's now over $985 million. And that's going to ensure that we continue to provide older New Zealanders with the very best possible care into the future. Our budget has a number of measures to protect the vulnerable and to add to the health of New Zealanders, to their quality of life. And I think this is proof again, as if we need more proof, that this is a government that cares. We do deliver on the things that matter to New Zealanders, and we are very mindful of our responsibility to rise above the petty politics of the people in the opposing benches and instead to deliver what New Zealanders need and want. Mr Speaker, thank you.